For those of us considering having a plastic surgical procedure, one of the biggest concerns is the issue of safety. I'm sure you've asked this question over and over and over again. Is plastic surgery really safe? In this short video, I'll be answering that question. From the inception of the practice of plastic surgery, which can be dated to 3,000 years before Christ came, unwanted outcomes in plastic surgical procedures are not uncommon. Even today, after so many years of practicing plastic surgery, we still know public figures, celebrities, and popular people who have undergone plastic surgery and also succumbed to have unwanted outcomes. The question is, why do unwanted outcomes happen? Why do undesirable outcomes occur? Let's begin by listing a few of the undesirable outcomes that may occur following a plastic surgical procedure. There may be bleeding, there may be fluid collections, there could be infection at the surgical site, which could result in a delay in wound healing, it may result in abnormal scarification, and it may result in death. So, why do undesirable outcomes happen? There are quite a number of factors, but we've classified them. First, let's talk about the surgeon factors. Your surgeon may have limited experience in performing the procedure of your choice. In other words, he's at the beginning of his learning curve, and undesirable outcomes are more common at the beginning of the learning curve. As your surgeon gains experience, undesirable outcomes become less frequent in his or her practice. Secondly, communication skills. If your surgeon is unable to communicate with you in clear terms about the expectations he has of you and instructions that you have to adhere to, it's wise for you to ask questions. There are factors that are related to the patient or the client. One is the health status of the client. When you have a client that has a poor health status, undesirable outcomes tend to increase or multiply. Number two is non-compliance to instructions. When you have a client or a patient that you have operated on who fails to adhere to the instructions that have been given as regarding post-operative care, then the chances that undesirable outcomes will occur increases. Finally, when you have a poorly prepared patient, a patient who has not been prepared properly for a surgical procedure, the chances of undesirable outcomes are very high. Environmental factors refer to the clinic or the facility where you're going to have your surgery. If you had to travel to have your surgery to a different country and you don't have free access, it's a poor risk factor for undesirable outcomes. If the facility where you're going to have the surgery is poorly equipped compared to the standards of an accredited hospital or is poorly staffed, then the chances of undesirable outcomes are also high. When it comes to the issue of preventing undesirable outcomes, there's a lot of similarity between flying and surgery. No pilot ever takes off planning to crash his flight. The same way, no surgeon ever performs surgery intending to have an undesirable outcome. We first of all prepare, then we undertake the procedure, and then in the post-operative period, we see to it that the healing occurs without complications. Now, if you examine an aircraft when it's taking off, there are steps that have to be taken, procedures that are undertaken to ensure that that plane is safe to fly. It's checked and double checked. We do the same thing in surgery. During the course of the procedure, it's like you're just walking through a manual. You have an assistant who double checks that everything you do is according to the standards. The same thing that happens in aviation, we also have those things in surgery. In fact, in surgery, sometimes we even have a backup surgeon who is just observing and running commentaries. We also have trainee surgeons who have gone through the procedure in their mind, they have read it so many times, and they're all asking questions. So all this reduces the chances that a mistake will happen. And then in landing, which is after surgery, we take exceptional care to ensure that your wound has uninterrupted healing. The process of healing should be smooth, should be straightforward, and should be uncomplicated. The activities that we undertake before surgery, which we call in surgical circles pre-operative workup, include taking a detailed history. We want to find out Have you been sick in the past? Do you have any illnesses that can compromise the outcome of surgery? We also want to undertake a physical examination as thorough as possible. We're looking out for telltale signs and features of other diseases that may interfere with surgery. We're also examining that part of the body that you have desired to have operated. We also undertake some investigations to ensure that your physiological system can withstand the stress of both surgery and healing and anesthesia. Then, finally, we talk you through the procedure. That process of talking you through the procedure is called obtaining an informed consent. During the surgical procedure itself, your surgeon will work with a team of doctors and nurses and other health professionals. There will be sometimes 2, maybe 3 surgeons at work, depending on the need. There will be an anesthesia team composed of at least 2 people. There will be a scrub team, the team of nurses that hand the surgeon the instruments. There will be a circulating nurse. So it's quite a number of people. Whenever you see a surgeon operating alone, it's a red flag. Your surgeon will endeavor to be meticulous during the procedure to avoid unnecessary complications. We'll maintain professional standards as much as possible. And then within the theater circles, there's the aseptic techniques that we engage in to prevent and reduce to basic minimum the incidence of infection. We do that to avoid bacterial contamination of the instruments and the surfaces that we are working with. After surgery has been completed, there's still need for the patient or the client and the surgeon to have close communication. The client needs to adhere strictly to the drug regimen. Some of the drugs that will be administered include painkillers and antibiotics. These are very important factors in reducing the incidence of undesired outcomes. The client also has to adhere to post-operative instructions. There are special instructions that can be given. The way to sit, the way to lie, what to wear, what to eat, what to avoid, they're all very, very important. The patient also needs to understand the very early symptoms and signs of undesired outcomes so that you can complain to your surgeon. And with early detection, a prompt response from your surgeon is required to avoid these undesired outcomes from being established. You can now see why things like holiday surgeries are not really encouraged. If your surgeon is halfway across the Atlantic, there's obviously no way that he's going to be able to help you to avoid undesirable outcomes. By now, I'm sure you're already recognizing the similarity between the aviation industry and surgery. We do pre-operative workups before we operate. Our surgical procedures are well chronicled and according to standard techniques that have been standardized all around the world, reproducible everywhere, documented in manuals and textbooks, and we pay close attention to the healing process. Our pre-operative workup can be likened to the takeoff procedure that pilots and the aviation staff undertake before a plane takes off. While you're cruising in the air, it could be likened to performance of the surgical procedure. The landing procedure of an aircraft is very similar to the healing. No pilot takes off without knowing exactly what his destination is and having an alternate destination. No surgeon also performs the surgery without knowing exactly what the outcome will be and including alternative outcomes. In this short video, I hope I've been able to enlighten you and show you some of the steps that plastic surgeons take to avoid undesirable outcomes, including death when we're undertaking procedures on our clients. I'm sure you will have more questions. Please feel free to reach out to us on our social media handles or on our website. My name is Dr. Opara, and I am a service provider at Beyond Vanity Plastic Surgery Services. We'll be expecting to hear from you, feedback, questions. Thank you.